And you'd be afraid to check in a hospital that wasn't, didn't have that specially marked off, which I know New Albany does.
We did, exactly. We had negative flow rooms. We had special unit designed and all those kinds of things for that. You bet. We're fortunate in one respect in that most viruses, they want to spread themselves to more people. So they're usually, as they develop or mutate or change, they get less severe and more infectious, which is kind of an interesting way to see it. And even COVID has done that for us for the most part. So it will never go away completely, but it's not really as bad as it was in terms of getting it as it was when we first saw it come onto the
few weeks ago, and it wasn't nearly as bad as it was the first time I had it.
For sure.
The first time I had it was horrible. I thought I was leaving here, and my husband did.
Goodness. I'm sorry to hear that.
It's a very serious disease.
It is.
But I don't think it's as prevalent as it was.
No, it's not. And we track those kind of numbers, et cetera, in our meetings. The lab people keep detailed numbers on that.
But it does weird stuff to you.
Yeah.
It does. My hair fell out. That's crazy.
It's looking good today, though.
Well, thank you.
I'll say.
I work hard at it.
Okay, that's good.
That's what I do.
I tell you, Baptist has seen and New Albany has seen a lot of growth. That's one thing that's important to say as far as that goes in terms of talking about the hospital and the different units. The Baptist system now has 24 hospitals. So we just incorporated with Meridian Hospital Anderson, and that's made us. Our oncology services provide more oncology care in all of North and Central Mississippi than any other providers.
How many hospitals do you know? How many are affiliated with Baptist?
Like I said, there's 24 in 3 states at this point in time. We're in Arkansas, Tennessee, and Mississippi. So it makes it one of the largest healthcare systems in the Southeast. And we're fortunate. We're talking about linking together somewhat Boonville and New Albany and Oxford, because we're all here in this same exact area to get our services and those kinds of things linked up and developed. There's a lot of effort looking at how is healthcare going to look in the next 10 to 15 years. What are our community needs? There's been a big trend towards outpatient care. Probably one of the biggest areas of growth for us has been in outpatient services. Lab and X-ray are up almost double of what they were a few years ago. We have a PET scanner that comes to us occasionally. Physical therapy is busy. And we have a sleep lab now that's providing assessment for patients, which is really that's a nice service to be able to add to the community. Yeah, and we have our private doctor's offices in the 5th floor, and we have providers that will come up there from urology and cardiology and podiatry, and hopefully we will even be adding more to that as far as that goes, to be able to see people who can come to New Albany and get their appointments done.
Not have to go way off.
Not have to go way off. Exactly.
When Shirley Wayne had to see a urologist, that was a lifesaver for us.
Yeah.
Because we're older, we don't drive that well, and we don't want to drive to Memphis or Tupelo.
No, it's an access to care issue. It truly is. Yeah, it is
wonderful. And I have a problem walking, and when I got there, the first thing they did was offer me a wheelchair. They're the most thoughtful people work at New Albany.
It's a wonderful place that way. Yeah. And again, I mean, that attention to detail gives us quality and safety numbers that are just tremendous. We have the CMS 5-star rating. Another group that looks at hospital performances in that regard is Leapfrog. And we recently received a specific award targeted for those hospitals that have received an A rating for 5 years consecutively, which we have.
On that name.
And that's very special. That's very special. Exactly.
Yes.
We're baby friendly certified as far as that goes. We're getting ready to go back through a reaccreditation for that.
Is there anything as exciting as bringing new life in the world?
Not a lot, I'll tell you that. Not a lot. It's pretty special, and our numbers are up at the hospital. We're somewhere pretty consistently 80 deliveries a month, and going to be maybe even up to towards 100 at the end of the year. Looking at targeted deliveries. So other than CMO, my other job is I work as a laborist, and that's an interesting job. I'm there. I take 24-hour shifts in labor and delivery. We're one of the few hospitals in our area that staffs labor and delivery 24/7 with a physician. And we're there for emergencies, obviously. We're there if the physician is on his way and something needs to be done. We're there to manage the more complicated cases and more challenging issues so that the physicians can turn their efforts elsewhere. And that's a wonderful. It's a great place. We don't have an NICU, but we have good relations, close relations with those in our area, and so that's able to be done well. Emergency department was just built just before I came here. I think it finished in 2014, and it is state of the art with 20 plus beds and patient flow areas. One of the things we're facing is with steadily increasing numbers is how best to handle the patients and the volume without having wait times that are a concern, because I know that's a big issue for everyone. We've changed part of the way that we're handling that, and I think that the community is going to have to get a little bit used to that, in that there's an initial assessment that's done rapidly in triage, and then the patient many times will be returned to the waiting room, and specific lab testing or x-rays or those kinds of things that need to be done before the doctor or the nurse practitioner can make their disposition and make a plan and whatnot needs to be done, so that the lab and the x-ray people will go get the patient from the waiting room, take them to an area, do those testing, get those results back, and then they're brought back to the emergency rooms where they're seen, and then that's where treatments begin. Other than obviously emergent circumstances where you're taken immediately to a trauma room or to a room where you need to be seen in the back. But that seems to be helping our flow, the patient flow, a lot, and cutting down our wait times, because our numbers clearly are up. Normally, the spring and early summer would be a fairly low time, but it certainly has not been that for us. Lately, our numbers are just booming. So, and that carries over to our med surg unit, which those numbers are up as well. But we're very fortunate to have the hospitalists who help care for these patients. And
tell us what a hospitalist is.
Well, hospitalist is somebody who doesn't usually have a private practice outside in a clinic environment. I mean, they are based in the hospital to care for the patients who are there. Some physicians choose to let the hospitalists take care of their patients fully when they admit them to the hospital, so they don't have to come over to the hospital and make rounds and write orders and do those kinds of things. They specialize, I think, in the hospital, more hospital directed care.
What is this is off the wall, so I mean I don't know, but some doctors, of course, all my life a doctor's been an MD.
Mm-hmm.
Now there is something else, a
DOs, doctors of osteopathy.
What is that?
Well, allopathic medicine is MD training route, and the DO is a different medical school path. They are still they're still physicians. There's some other ways in which their training differs, but fundamental aspects of medicine are going to be very, very similar. As far as that goes, they have to go through similar testing and similar training and those kinds of things to get their licensure, and they're usually covered by the same medical boards in terms of that as MDs are. Okay. We actually have an opportunity to be a training facility for the Liberty University College of Osteopathic Medicine out of Virginia, and have 10 third-year medical students here and 3 or 4 fourth-year medical students here who are doing their clinical work with our physicians here in New Albany. So that's
now,
a
when
wonderful
they
thing.
Graduate, will they be that DO?
They will be a DO.
Mm-hmm. DO.
They will be a DO.
That's a common thing, isn't it?
Well, there's a tremendous need for providers, and there's been a more expansion of the DO schools than the MD schools, I think, as time's gone on. So
I was surprised. Of course, I give my age away, but I was surprised that the nurse practitioner thing caught on so much.
Well, nurse practitioners follow under the nursing board, and they are what we call advanced practice nurses. So there's nurse midwives, there's certified nurse anesthetists, there's advanced practice nurses such as those that work either in our emergency room, for example, or there may be office-based. They work with our hospitalists program as well, as far as that goes. So they're
Some of them are amazing.
there's a term, physician expanders, and I think it's one of those things. They operate under specific protocols and are able to care for many aspects of medical care. And they are running even now clinic environments as well to be able to provide more access to care. Because in Mississippi, access to care is a huge issue. I mean, to be able to have the number of providers that we need. A lot of people don't appreciate how wonderful Mississippi is. It's just a true gem. And again, the people are great here. It's just getting people to look at Mississippi for a serious opportunity to practice and to live is a little bit of a challenge as we face trying to recruit to our smaller communities. And small communities across the country face that. It's really not unique to Mississippi, but I think I find that challenge in Mississippi even harder.
I think so, because I don't know, back years ago, maybe we were behind, but now, if we were, we got bad things last. We were still clean while other states had drug problems.
Right. Well,
we got it. We've got it, but
we've come a long way. It's one of those
first.
things. Come a long way.
First.
Yeah.
So maybe we are slow, but sometimes that's a good thing.
Well, I think that there's opportunities here in terms of focusing on health. One of the areas that I'd be remiss if I didn't mention it at Baptist Neurology is our oncology program.
Yes.
And oncology is wonderful as far as that goes. We have hired Dr. Obaji, who is going to be a full-time cancer physician for us at New Albany, and he is a brilliant physician. He is a Christian from Syria who moved his family out there to avoid difficulties there. And I think he's going to be a tremendous addition to our community. One of the things that Mississippi is not as good at is that we smoke more. So our lung cancer rates aren't as good. But one of the programs that we have here that we're doing with Baptist is the Mississippi Miracle Project, and our goal is to reduce lung cancer mortality or deaths in Mississippi by 25% by 2030. And that's an ambitious goal, but it's one of those things. Cancers are staged, and stage 1s and 2s are very potentially curable cancers for lung cancer, and 3s and 4s are much more challenging. But I think it's one of those things that you've got to get them diagnosed and diagnosed early. So we're actually working with a company that is analyzing reports of all images that are done throughout the Baptist system, looking for key phrases or words that might tip off that there's a finding there that needs to be followed up on. For example, if you came in with a fall and they're worried about a broken rib, the report would focus on that, but there might be what we call an incidental nodule, an area up in a lung space that isn't part of that original care. And if that doesn't get followed up on, then you're at risk for developing further problems downstream. So we even have somebody called a nurse navigator for the lung nodule program at New Albany that is involved in orchestrating the care for these people. There's a specific set of criteria that will, based upon the appearance of these kind of things that are found in the imaging, how it needs to be followed up, 3 months, 6 months, right away, those kinds of things. And so our hope is that the Mississippi Miracle will truly be that. It'll be a miracle.
It will.
Yeah.
It will. That's a lot back in the 60s and 70s. Things just got ignored. Mm-hmm. And by the time that was a true problem, it was too late.
Exactly. Well, one thing about it is that, people are living a lot longer, period. Okay. Yeah. Longevity is up. Due to a lot of things. And to some extent, public health issues, to some extent, diet, to some extent, it's other things. But now we have to focus on better care of our elderly people in terms of looking for all these kinds of things and making sure that they get everything that they need.
Yes. And, a lot of your elderly folks really want to be at home.
Exactly.
They don't want to be in an institution. Now, some people need to, and maybe it depends on your circumstances. But I know now that, there's help for them where it used to not be.
There's a lot of options in that regard, and Baptist has a very good home health system in place that will come do home visits for people, and we have even physical therapy involved in doing some of that. We have hospice that works with us. There's several hospice organizations that we work with for the term palliative care, which is more than just giving up. It's a true management of the big picture of things as we approach end of life, and that's it's a wonderful service that's developed as far as
We're
that
gonna
goes.
all get there. I worked for 5 years for Legacy Hospice, and I don't know if I thought when Suzanne talked to me about the job, I thought, oh no, my husband had just died, and I thought, no, I can't do that. You're already crying all the time. I can't do that. But it's not like that. I enjoyed that more than anything I've ever done.
It can be a very meaningful
go
experience
and
for sure.
Make their last days better.
Exactly.
And that's what we did. I was a volunteer coordinator.
Wonderful.
And enjoyed it more than anything. I really did. Really did. Did it for about 5 years.
Well,
But
none of us are going to get out of life
hospices-
alive.
That's
Okay, it's one
right.
of those things, and you can't
That's right.
turn the hourglass over, unfortunately.
And the care that these people got, and they wanted to be with their family. They want to see their grandkids. The grandkids, if they're little or great grandkids, can't come in the hospital. They won't let them.
Right.
So I mean, it's pretty amazing. Pretty amazing.
That's a cultural shift that I think is really going on, and I think it's very healthy. The idea of going to a hospital to die is probably that's not the best place. It really isn't, unless you need GIP or one of the more complicated levels of care that can be done in a hospital environment, but really not truly in an acute care setting. I mean, it's better if
Well,
you
it
could
depends on your
be around.
circumstances. If your family is peaceful and you want to enjoy your grandkids, or but if it's a ruckus all the time, you're better off in the hospital. That's right.
That's true.
Because those folks will protect you.
They will have your best interest at heart. You
That's
hope.
right.
You hope at least, right?
Oh, they do. They do.
Yeah.
That I carried a young man over to New Albany Hospital, and I just sat in the parking lot till he got back. It really didn't take long. A couple of times a week for wound care. Y'all have a facility just for wound care.
We do, and we're working with a specific company to help us expand those services. One of the things about that is that we had an excellent nurse who's been working with the wound care unit for a good period of time, but we're getting providers in place, nurse practitioners or advanced practice nurse who works with the general surgeons themselves, to be able to go over and assess more complicated wounds and do that kind of work. If the providers are there, that allows better coverage or the cost of the wound care supplies and those kinds of things, which is a benefit to patients.
They sent his stuff home with him.
Exactly.
Yes, they did.
And that's a tremendous improvement, and that's something that's really re-blossomed, I think, within the last 6 months to a year.
Well, they sent stuff I never heard of before home with him to put on that wound.
Exactly.
And get it healed up.
And they do well.
It's amazing.
They really do well.
He did. It was amazing.
That's good.
Especially if you got something that just won't go away.
And as we get older, our skin gets thinner and those kinds of things, and it doesn't heal as quickly, and it takes more attention. It does.
He had sugar, had diabetic, and it just wouldn't heal up. And he had tried. He'd been in the hospital, and he didn't know what else to do, and they put him in that wound care, and those people took care of him.
They do really well.
They did, and they would call and check on him, or he may have called them. I don't remember. But I know he stayed in touch with them even on the days he didn't go. He could get in touch with them. You know, it's this wonderful program.
And for those patients that have wounds or issues in the hospital, there's specific order sets and protocols in place and whatnot to be able to assess and take care of those things while they're in the hospital. And then the issue is getting them shifted once they're out of the hospital to make sure they continue to get that level of care. And that's where the wound clinic really
I didn't
fills
know
that job well.
I didn't know there was a wound care over. I knew there's one at Tupelo, but I didn't know there was one at New Albany till he had to go.
Yeah.
That's amazing to me, and they're fast. I mean, I'd sit there. I'd take my tablet and I'd roll the windows down on the car, and I'd just stay in the car. It's not long after COVID, so I mean,
you didn't want to go in the hospital
I didn't
anyway.
want to go in.
Yes, I understand.
But he wouldn't be gone an hour.
Right.
I mean, so apparently they're not letting them sit and just sit and wait. They're keeping them moving.
The goal is to do that with everyone in the truest sense of the word.
Mm-hmm.
No one likes to wait. The impression that the old days of sitting and waiting in the doctor's office for a long period of time, I think, has to change.
Yes,
it gives everyone the impression that we don't value your time as much as we value our time. Mm-hmm. And I think that's really, it's never really been that way, but that's certainly how it looks, and to patients. And I think that we're changing that a lot.
You know, if you get a bad impression of a place, it stays with you for years, and probably those people don't even work there anymore.
Yes.
It's all new people, but you still got that impression, and that's sad.
The same thing restaurants face. You know how that goes, right?
Yes.
One bad waiter and
that's it. You're done with them.
Exactly.
Yes, absolutely. And that he may not even work there no more.
Right.
It's amazing.
But that's one of the things about Baptist in New Albany that is so wonderful is just everyone who's there, from the administration through environmental services, through lab, X-ray, everyone sees themselves as part of a team that cares for patients, and everybody's role is important.
When I went up there about my heart, I found it less professional and more family, which to me was a plus.
We try to balance that out, if that makes sense. Mm-hmm. I mean, professional translates to cold and precise. Yes. You want to be precise, but you want to be warm and empathetic.
That's right.
I mean, understanding of what the patients are going through and putting yourselves into their shoes.
When Dwyla sent me, I thought, oh my goodness, my heart. Oh, there's nothing wrong with my heart.
That's good. That's
nothing.
Good. That's good.
It just
rumor has it you have a big heart, so.
Well, I hope so.
Not too big, just big enough.
Probably big, yeah. But it just when they tell you you've got cancer or you've got a heart problem, or I mean, even if it's nothing wrong, that takes 10 years off your life. But you go over there, and these people do not let you be uncomfortable or afraid. They don't. They've got the people that I was in contact with, they used to call it a bedside manner.
Mm-hmm. Mm-hmm.
They got it over there. They do. If you're looking for a place to go where you can go comfortable and be treated right, that's the place. It certainly is. Mm-mm. But and I found the wait time to be more reasonable. And I went in and I sat in this comfortable couch.
There you go.
Mm-hmm. I did. I mean, it's not like an office.
Right.
I sat down there for a while, and then we went up on the 5th floor, and there were chairs that had arms, easy to get up out of. I hate it when they don't have arms.
Attention to detail. I mean, it's one of those things. You have to. Yep. That comes from putting yourself in the patient's position.
That's right. That's right.
In my office, once upon a time, I used to hold meetings for the office staff. And one Friday morning, I had everybody scatter and go to the waiting room or to one of the examining rooms or whatnot and sit there for 20 minutes. It's amazing the things they saw, thought about, realized in that 20 minutes of quiet time by themselves in a room, putting themselves in the position that the patients were in. Be it corrosion at the edge of the faucet or the dating on the magazines. Mm-hmm. whatever. Okay, I mean ceiling tiles that
That's
I mean,
right.
needed to be attended to. So
That when you're in a rush, you don't notice.
you don't notice it, right? Exactly.
You're right.
So
But I found it a very pleasant experience. I mean, not that I would want to be sick, but if I was sick, that's where
it's
I'd
a place to go.
That's where I'd
Exactly,
want
it's
to
a
go.
place to go. It's kind of what I tell the people who are the maternity patients, the OB patients, that it is truly a wonderful, wonderful place to have a baby for low risk moms. I mean,
Yes.
if your circumstances are so complicated that there's no way to do it safely, or it needs the attention of someone that's a higher level care, then that's valuable as well. But for our folks, we do C-sections there. Yeah. And that's one of the things actually that's worth mentioning, is that there's a term called NTSV, and it is the question of how many mothers coming in for the first time to have a normal baby at term, and how many of those are able to successfully do that vaginally, as opposed to ending up with a C-section. And those numbers vary across the country substantially. Our last month's rate was as low as 13%. The goal is to get it in the low 20%, period. Our average has progressively come down as we're focusing on that a lot. We're reviewing every single circumstance that happens to make sure that there's really nothing in our processes that can be improved to make patients more successful at delivering.
You don't hear the horror stories anymore like we used to. Years ago, things. I know when my second child was born, my husband took me to the hospital, and I looked and I said, "This is not a hospital, it's nursing home."
Oh no! Oh no!
It was on the back of the hospital. And this nurse came out and she grabs a wheelchair and she puts me in the wheelchair and runs through the nursing home.
Wrong door.
Yes.
Wrong door.
And
I'll bet that made them excited, because rule of thumb, people who are not used to dealing with pregnant patients don't like to deal with pregnant patients.
That's right.
It's one of those things.
Absolutely.
They just don't. They make them nervous.
It's something we laughed about as long as he lived. He carried me to the nursing home.
That's funny.
But but you don't hear about stuff like that anymore because they're more organized, and you don't go to the hospital and can't find the front door.
Yes.
And used to it was that way. Of course, that's a lot of years ago.
Interestingly, I find myself directing traffic in the hospital a lot. Okay, it's one of those things where, there's one of our administrators prior had a philosophy that I really liked, and that basically, if you're within 10 to 15 feet of somebody, you should acknowledge them, speak to them, and I think that's very meaningful. So yes. I'll come up on somebody who has as I call it, the lost look. And I'll say, "You have that lost look. Can I help you find something?" And I'm looking for XYZ, and it's this away, or let me walk with you to get you there. Used to be they painted lines on the floor,
yes,
okay, and you had to just follow the red line to get to the emergency room, or the blue line to get to lab, or whatever. Which obviously that's not the direction we've gone at this point in time.
Yeah.
But the personal approach, I think, is what's wonderful.
And I noticed you have on a lab coat.
Mm-hmm.
You wear a lab coat at work?
I do.
When you got on a lab coat, anybody knows you're working there.
Exactly.
And so many times they don't. I know one time my second husband was in the hospital, and I walked up and down the halls looking for somebody that worked there. It wasn't New Albany. But, it was kind of scary to me.
Mm-hmm.
And I probably walked past a lot of people that worked there, but they didn't have on a lab coat.
Well, there's interesting history behind lab coats itself, et cetera. Even in medical school, you get a short lab coat, okay? And only when you've gotten further in your training do you get a long lab coat, okay?
Oh.
So I wear a long lab coat.
Oh.
But a white lab coat and white hair tends to tell you that you've been here a while.
I've been there a while. Yeah. But you're used to, things were just different. and it wasn't as easy to know where to go or what to do. You didn't have everybody was in a rush, and they didn't take time to stop and talk to you like they do now.
I think part of that is probably due to a change in our entire approach to the care of the patient. Once upon a time, it was enough to simply make a diagnosis and fix the patient's illness.
Yeah.
Now we're actually talking about something in terms of the complete patient experience. I mean, that their experience in healthcare, because we've discovered that influences how they view their health, how they follow up with their care, and quite literally, how well they do with their recoveries. It's one of those things. I mean, you have to get buy-in from the patients that they need to participate in their care in terms of life-changing events. We need to, to follow up with appointments. We need to take medicines, those kinds of things as needed. But we need to, engage them well. And part of that comes from looking at the big picture. So that patient experience. And I think that's been a very big help. It's probably part of what you're talking about there.
Probably is. It just I know if you ever get a bad taste in your mouth, you're not coming back. Mm-hmm. And it's not necessarily because of the medical care. I never went back to the hospital because I don't want to run up and down the hall hunting somebody. Well, that's been years ago. Those people are not there anymore. Right. Things are different now. But you get that bad taste in your mouth, you don't want to go.
True.
I've told my children, if I get bad off, don't take me there. I mean, that's awful.
Well, you're welcome at New Albany.
Oh, I like New Albany.
Anytime.
Yep.
Anytime.
Yes. That's one thing. If you are comfortable with your doctor and you're treated well, and this new equipment is something, isn't it? Mm-hmm. I mean, it's not. I mean, like even the hospital beds and are updated. They're not like they were years ago where you got to get somebody to come crank it up.
There are no cranks on our hospital beds. Mm-hmm. I can verify that. Of course, they're pricey now. You know how that goes, okay? Yeah. But they have, the newer beds have built-in scales. They have built-in alarms so as to let us know, if a patient that should not be getting out of bed is getting out of bed, those kinds of things. A lot of features involved in that amazing, kind of thing. So, yeah. Used to have require a lot of other attention.
Beds and it's amazing to me. Some of them, if you don't plug the bed up, the room don't come on.
Right.
The lights.
It's all an integrated system.
Mm-hmm. Yeah, and when they unplug that bed, everything's off.
Right.
That just amazes me. Technology has come a long way.
It certainly has.
It's a good thing. The alarm if a patient's getting up or falls, or sometimes maybe they're kind of not thinking right. Mm-hmm. So that's a plus.
That's something that we watch very, very carefully.
It might be hard-headed like me and think, well, I can get that bathroom. I know I can.
And you'll be wearing an armband on your arm that says fall risk. I can see it now. Okay, a yellow band that says fall risk. I can see it now. Yes.
Yes, absolutely.
Well, we track all of that kind of thing because actually, for our purposes, a fall simply means a change of plane. I mean, you can be helped to the floor because your knees give out, having two people, trying to help you. That's still considered a fall in our looking at things. I mean, the goal is to avoid anything that way, and we keep track of all of those kinds of numbers. There's a process that we have which is called Oscars, and Oscars are reviews of events, either near misses, okay, good catches, successes, those kinds of things that we want to look at more closely. That term process focus, which is my word for the month, for the 11 guiding principles, talks about looking carefully at how we do things. The goal is to make doing the right thing, given, and doing the wrong thing, difficult if not impossible. Mm-hmm. That's what you really want to have all the time. So one thing about the environment of our hospital is that we look at everything that way. We have a trusting environment. It's a very open environment. People are willing to speak up and say, I've seen this and I think this is a concern. And I think that's important. I mean, it's very much a see something, say something culture. And that's a healthy hospital.
Yes.
I mean, I used to talk a lot about hospital cultures. I worked for an organization that had a Center of Excellence program, and I would do site visits. This is for gynecologic surgery, and hospital culture matters a lot. It influences nursing retention. It influences those patient satisfaction scores. It influences the quality and the safety scores. I mean, that running undercurrent of that culture is what does so much for things. And I'll say that truly the Baptist system in New Albany is probably the best of that I've ever seen, that I've worked in anyway.
Can you go in the hospital from the back?
The back side is the emergency department
Yeah.
access, and the front side is the front main lobby. And so the emergency room access is open 24/7. The front is open daytimes until 6 p.m. and then it closes at the front.
I was thinking about the hill on the front.
And we've recently resurfaced that parking lot and did more striping and did some concerning issues there in terms of where wheelchairs can go and are allowed to go and not allowed to go, those kinds of things. But there's a circle drive that comes up there that's covered. I mean, and that's the best answer.
Sick enough to go in the hospital, you about need somebody to drive you there anyway.
I think that's probably wise. It probably is.
But I noticed that parking lot in the back is flat.
Yes.
I just wondered if you could access the hospital that way.
If you go through the emergency department access and park in those areas back there, again, it's all one level that goes up to that entryway. And again, there are the security folks that are there, other folks that are there, et cetera. There's wheelchair access there as well.
Yeah, somebody will help you.
Right.
Yeah, that's what I wondered because I had that problem.
Mm-hmm.
So I just wondered about that. I didn't know that in the back was flat till I took the boy for wound care.
Right.
And I just thought, man, this is where I need to be parking. What's my problem?
I'd have to walk up the hill.
That's right.
There you go.
That's right.
Yeah.
Because I can't. Yeah. But little things that we don't think about make a difference. It really does.
All the little things make a difference.
It does.
They're part of the fabric of the entire experience. Exactly.
Mm-hmm. And, like I say, when I went, I left with a good feeling. I did.
Well, that's our hope. That's our hope.
Do your children live here?
I laugh and will say my youngest accused us of moving away from him when he went to college. Okay, instead of him going away to college, my parents went away. He thought that was interesting because he went from Topeka to the Kansas City area to go to college, and now that's where he lives still. We have Kim had two boys, and they both live in the Kansas City area. And then my others, one lives as a nurse in Washington State, and the other two live in Topeka, Kansas still. So they're a good ways away.
Hard being away from the children, isn't it?
It is. It's a challenge. But thank gosh for technology and FaceTiming and all those kinds of things.
But it gives them somewhere to go on vacation.
It does. It does.
Yes.
Indeed.
Yes.
For Thanksgiving last year, we all rendezvoused at Branson at a big house there that we rented for the weekend, and that was perfect. Well, it was Thanksgiving. It wasn't that bad. It was fairly cold, but still, yeah.
Yeah, I mean, I lived in Missouri, and we had knee-deep snows.
Yes.
I'm telling you.
Yes.
So, and people there go to Florida for warmer weather. We got it here.
Yes.
I love Mississippi. I really do. I'm not from here either.
Now, people accuse me of being a jungle person because I like the humidity and the heat. I mean, my wife calls me an iguana. Go figure, as far as that goes, that I can take the heat well. But it doesn't seem to bother me. Some people find that just miserable. But if you get acclimatized to it, it seems to be okay.
Well, if you get older and this cold hurts your bones. We'll find that out one day, won't we?
Indeed. We'll get to the root of that problem right there, you think? Uh-huh.
Yes. Yeah, there's some things there's no cure for, and I think arthritis is one of them.
There are things we're destined to struggle with.
Yes.
Yeah, we're destined to struggle with.
I really do. Really do. But I think the hospital has grown a lot the last few years.
It really has. One thing about it, since Baptist took over, they have reinvested literally millions and millions and millions of dollars into the hospital, in terms of both development
It's amazing.
and in terms of the maintenance and the care, and they're committed to continue to do that. The question is what are our needs? I mean, there are
And
people
you've
in
got
our
a good
community
location.
that ask about, do we need a new hospital, for example, or do we need the expansion of a big medical building next to us, or do we need something else? And we're in the process of looking at that now. I think that's the big question: is what is the future for medicine like?
What's next?
What are the needs of our community? How can we best meet those?
Well, now you got a good location there.
It's right off the highway, and it works really well. And the doctor's offices are all around. Yeah, it's a true medical community.
Sometimes that's the problem. The locations are so bad, and that one's got a good location. It's easy to find.
And it's hard to rebuild over an existing position.
It is,
because you've got to keep it operating until you get something new in place. Mm-hmm. And there's, but even then, there's only so much remodeling you could do to existing structures.
That's right.
One of our challenges is the fact that the water access is limited in terms of how much inflow there is to the hospital, and there's one main direction that way, and it's better to have redundancy in terms of more options.
Yeah.
So we're looking at lots of things, but access is important to the hospital.
Well, you got good access there, and it's right where it's easy found.
Mm-hmm.
I have had, like when I had my child, our problem was we didn't know where the hospital was. We were new in town. We didn't know where the
Didn't know where it was. You just go to the nursing home. They'll be able to get you there.
It worked. It worked out.
Goodness, that's a story. That's a story. Right there.
But we are just slap dab out of time. I appreciate you coming.
You betcha. Thanks. Nice to be here. I appreciate the opportunity to share some of the aspects of my life and the hospital. And it's like I say, truly, I always say it's an honor and a privilege to provide service and care. It's been my goal in my life.
One of the most interesting things you did was go to Ethiopia.
Jokingly, people said, "How did you get to go to Ethiopia?" Okay, I say we drew straws and I lost. Okay, no, the other people went to France and Germany or someplace really cool like that. But our high school was a sister school with that school district, the American Community School that was there, and it was 250 children from kindergarten to 12th grade. So my class size was 11 or 17 or something like that, et cetera. Those real small classes, and 150 of those 250 were Ethiopian scholarship students. So it was an interesting cultural environment.
Well, it's amazing to me you came back in one piece. They start shooting at folks.
I was very fortunate. That's all I can say. I was very fortunate,
Yes,
but I was blessed to have the experience.
That's right.
It's a wonderful experience.
That's right. It's a whole different world over there.
Like I said, it's really, we need to be appreciative of everything we have in the United States.
That's right. And we're really not. We're really not. We were born here and we're just used to it.
We take a lot of things for granted.
We do. We do. We need to be thankful for what we have.
Yeah.
Appreciate what's done for us. And we do appreciate you coming.
Thank you.
And this is Daryl at Daryl's Little Corner. Glad you joined us tonight, but we are out of time. Be sure and catch the Jeter Family Program on Saturday nights from 7 to 9. We'll be back Monday at 7 o'clock for Daryl's Little Corner. May God.
I'm Attorney Casey Lott. In our fight for justice, our day starts early and ends late. But we embrace the long roads and hard fights with the big corporations and insurance companies that put profit over people every day. With 7 lawyers manning our offices in Tupelo and Boonville, we have the resources it takes to fight the big insurance companies for you. And the difference we make for those who've needlessly suffered makes every minute and mile worth it.
This program brought to you by the Tippah County Board of Supervisors. Jimmy Gunn, District 1, Greg Harrell, District 2, Mike Graves, District 3, Glenn Michael,